Hi everyone, my name is Dr. Z. I am a clinical psychologist specializing in transgender care. Welcome to my channel. If you're a new viewer or a regular viewer who has not yet subscribed, please make sure you do subscribe. Not only are you going to be supporting me, but you're also going to be helping a lot of other people find this valuable and completely free content. And if you don't yet follow me on Instagram, link is below. Please also do go on Instagram and support me. That's where I show up every single day to support you by giving you tips, guidance, and advice. Not to mention, I do weekly Q&As on Instagram as well. So please, let's connect on Instagram. For today's video, I will be sharing with you three essentials, the three most essential, you can call them tips, you can call them strategies, or you can call him insights from a gender specialist that I have observed over the course of my career in transgender field when it comes to hormones. And we will be talking about both feminizing and masculinizing hormones. For those of you who identify as non-binary, for you, it really would be, depending on your goals, of course, it would be perhaps maybe a combination of those two or microdosing or other ways of regimenting your hormone treatment in order to help you achieve the results you need. But this video is going to be relevant for individuals of any type of gender identity who are interested in utilizing medical aspect of gender transition as part of their gender path. Now, today, as you know, hormones and information about hormones is all over the internet. Not only is it all over the internet, but in fact, I wrote a blog about it several years ago. It's called Don't Play Doctor with UHRT. And I mentioned in the blog how people tend to chase numbers that somebody else has mentioned. What I mean by that is that it's very common to see somebody post perhaps a pre and post transition or pre and post hormone and discuss how much the hormones have really changed their appearance, and then go on and share what exact dose and regimen they're on and discuss what their blood level numbers are. And then somebody takes that and runs to their gender clinic, runs to their endocrinologist, and asks to mimic the same results. That's what I see. That's quite common. You know what? I don't blame you. Hey, for me, for example, I'm always on a lookout for a ways to slim up, a ways to drop a few pounds. And so if I do see somebody who lost weight and then they tell you how to do it, of course, I'm going to want to try to mimic it. So while it is natural to want to mimic what works for somebody else, the reality is that when it comes to hormones, it's a completely different game. It's a completely different way of approaching it. And over the course of my career, working not only closely with my clients who are on hormone therapy, but also working with endocrinologists who manages their hormone regimens, I have learned quite a bit about hormones. And while I'm not a medical doctor and in no way what I will be discussing today replaces medical advice, I do have some tips that I think would be really, really important to know about. I think it's going to be really important for a lot of you to hear about. First, before I share with you the three essentials, the overarching umbrella essential for all of you to think about when it comes to medical aspects of gender transition, whether you are just about thinking starting hormones or you are on hormones, but you haven't really thought about this yet, your overall arching themes that you need to have in place before you even start, or if you again you started to think about it now, is what are your overall goals? Each one of you is going to have different goals. Some people want to change secondary sex characteristics as quickly as possible. And then the question becomes, well, how would you know when that's achieved? So we're looking for particular breast growth size, are looking for particular voice deepening and how quickly, what exactly are we looking for here? And you have to be very clear what your goals are. For individuals who are non-binary, also thinking about what you're trying to achieve and for how long you want to sustain that achievement. A lot of non-binary folks go on microdosing or having a variety of regimen, and then when they achieve their goals, stopping the regimen altogether. That's also very, very common. So knowing what your goals are. For a lot of people, when it comes to hormones, your goals are going to be physical, understandably so. For a lot of other people, starting hormones is all psychological. It is all about quieting down that noise of dysphoria. It is all about bringing that down. It's all about getting rid of that mental angst inside of your head. Everybody's going to have different goals. For some of you, it's even going to be a combination of psychological and physical. But the key here is to be very clear what your goals are. Here's the thing. If you don't know where you're going, how do you know when you're going to get there, right? It's the same analogy. If you are on a ocean on a boat and you don't have a destination, how will you know when you have arrived? So goals and being very clear what they are is going to be very important. Say, for example, your goal is to feminize and feminize as quickly as possible. Again, what is that going to look like? And what kind of time are you willing to commit to in case if it doesn't happen in a time period you want to? So goals is going to be your overarching goal. It's going to be the destination where you're heading to. Underneath this goals, now I'm going to share with you 3 essentials that I have learned over the course of my career. The first essential is going to be making sure you're working with a good endocrinologist. And if they're not an endocrinologist and just maybe a nurse practitioner or a general doctor, make sure they have experience not only working with trans folks, but they actually have experience understanding how to look at your blood work and understand how your goals are going to fit in the particular regimen. Sadly, this first tip is not going to be easy to achieve for a lot of you. That's because we still have a ton of medical providers who are deeply undertrained. Or we have a whole bunch of medical providers who stick to dogmatic old approaches. If any of you ever watched Will Power's video, the infamous video on hormones, just know exactly how many boats he rocked, and just know exactly how he brought to the forefront a lot of things about hormone care, especially feminizing hormone care, that nobody was discussing. So finding a good doctor is going to be so essential. Because here's the thing, even if you're getting hormones, but you're working with somebody who doesn't know what the heck they're doing, or they don't even know how to look at your blood work and analyze it and know what they're looking for, again, it's akin to going somewhere without a destination. So it's really, really going to be important to find somebody who is knowledgeable. The positive thing is that we have a lot of great clinics online who are quite skilled. For example, Queer MD. I'm going to try to remember to link it below. If I forget, please somebody just like DM me, ideal on Instagram, because that's where I'm most responsive, and say, hey, you video today, put down Queer MD. But it's Queer MD. They're quite knowledgeable. They're really good at reading and understanding when they're looking at your blood work. So even if you can find somebody in your region, see if they are able to provide services in your state. So that's tip number 1. Have a doctor who knows what the heck they're doing. If you're in a place where you just need to get started, or you're already on hormones and you feel like your doctor is not as knowledgeable, now listening to this, you are freaking out. Please don't freak out. You can always change your doctors. And if you are in a place where you have nobody else, being on hormone regimen, regardless if it's helping you, if you feel like you're getting some results, physical or psychological or both, that's still a net positive. Okay. So that's tip number 1. Tip number 2, or insight, I would say, insight number 2 when it comes to any type of hormones. And that's going to be, I would say, the most important tip that I have for all of you is this. Please trust me when I say this. No 2 people are going to have identical results, even though their doses and regimens are exactly the same. Let me repeat that. No 2 people are going to have identical results, even if their hormone dose and regimens are going to be the same. Here's why. Hormones don't just come in numbers. They don't just come in doses. A lot depends on how your body metabolizes hormone. A lot depends on your age, on your health, and on so many, oh my God, so many other factors. A lot depends on that. This is why you see people who may be taking exact the same regimen and they're further along, or they're not further along than you. This is why people sometimes struggle and can achieve absolutely no breast growth, and people excel at breast growth. This is why some individuals have their voice crack and deepen within a week, yes, or within a month, and others have to wait 6 months to a year to get the same results. Some people have facial hair immediately, some people have to wait. It's all because of these factors and so many more. Each one of you is individual. Hormones are complicated and complex. We're talking about medicine, how your body is going to respond to the hormones. Again, it's going to vary drastically. And this is where not only how your body metabolizes, but this is where the numbers play not such a significant role, in a sense that a lot of times people chase numbers, right? Oh, I want to be in this range. This is a range for cis woman. This is a range for cis man, right? Sometimes people are chasing particular numbers to be in, and this averages. But averages for a cis person may mean different than an average for you. There's a lot of factors here at play, a lot of factors. So instead of chasing those averages or those numbers, or particularly the numbers, people always tell me, oh, you got to take X amount of milligrams. No, it doesn't work like that. What you got to take and what you got to figure out with your medical doctor is what mix of cocktail, let's call it cocktail, what mix of my favorite, my goodness, gin martini. What mix of gin martini works best for you? Is the best mix for you 2 shots of gin? My preference. Is it one, or is it just a little bit more vermouth? You have to figure out what mix of cocktail when it comes to hormones works the best for you. I had people who were taking a low dose of hormones and have drastic results, and there was no need to increase the dose. I had people who were on a very high dose or on a regular standardized dose and struggle. In the end of the day, you got to work with your medical doctor. And in the beginning, it may take as much as up to 6 months, yes, to figure out. And the reason why it takes so long is because you want not only your body to give your body time to acclimate to hormone, to stabilize, and then assess what results you're getting on the stabilized baseline. But here's the beautiful part. Once you figure it out, you're probably going to stick to it for at least some time. And then again, you're going to modify it because as we get older, as other things happen in our lives, stressors, other type of things come up, other types of diseases. If we get, for example, autoimmune disorder, those are all going to affect how those hormones work in your body. For that reason, you got to work with your medical doctor. And what you want to look for is less necessarily numbers, although numbers are going to be super important for the doctor to look at, but those numbers in combination with how they're meeting your goals. Remember, your goals are both physical, psychological, or either one of those, right? So are you seeing your goals? If you're not seeing your goals, what else can you do? Are you psychologically feeling better? Is that alleviating things you need to alleviate? You need to find the mix, the regimen that makes you feel good, that makes you feel not only that you are evolving and shifting and changing, but also that psychologically you feel really good. Your dysphoria is alleviated, that noise is quieted down. That's what you want to look for. So that's the most very, very important strategic tip for all of you to remember. Now, the final insight, strategy tip, if you will, that I will cover today is this. Chances are, in some part of your hormonal treatment, you are inevitably going to hit plateau. I've spoken about plateau many times on this channel. I have a video on this topic. I think you can even Google Dr. Z hormones and plateau, and you're going to come up against that video. That's when suddenly it feels like you're taking hormones, but specifically the physical changes you want are not happening, right? It's almost like everything comes to standstill. Again, to make an analogy to exercising, you are in calorie deficit, you're eating less, you're working out, it's been 2 weeks, and the scale doesn't budge. That's hitting plateau. Things feel the same. If you do hit plateau on hormones, see what other factors may be contributing. Are you extra stressed? Did something else happen in your life? Is something else going on? If no other factors contributing and you're still experiencing plateau, it's a great opportunity to sit down with your medical provider and discuss what can you do about plateau. And yes, there are things you can do about plateau. One of the things a lot of my clients do is change or shift the route of hormone administration. If they were taking oral route, they switch to patches, or they switch to injections, or they switch to pellets. There's a variety of things that you can do. Now, all of this may seem anecdotal, and your doctor might say, there's no research for that. But here's the thing. Thousands of people I worked with keep telling me that the minute they change something, it's almost as if the body is now processing it differently because it is going through a different route of administration. And hence, somehow, it tends to jumpstart the changes again. In the very least, it's worth a try, right? You're going to have to take your hormones anyway. So I don't see how changing it from one way to another is going to change. In the very least, give it a shot. Hormone therapy for trans folks is all about trial and error. It is all about trying to find again what will work for you. I really wish there was a great one, maybe cookie cutter fits all, but it doesn't work like that. There are a lot of doctors who still use cookie cutting approach of standardized doses. And as a result, a lot of people are very miserable because you can't, when it comes to medicine, you just can't approach a cookie cutting thing to individuals, especially when it comes to their endocrine system. So these are my three, the most important tips, strategies, insights for you to take away today. Again, have your goals outlined and be very clear. Find a doctor who knows what they're doing. If you can, ideally, that would go miles and miles away for you. Number two, remember, it's not about numbers. It's not all about numbers. It's also about how your body metabolizes and works with that hormone. And number three, when you hit plateau, which most likely you will because everybody does, and that's okay, how can you switch it up? How can you play around with it? Comment below, let me know where you are with hormones. Have you had experience of working with a doctor that didn't know what they were doing and switch? What was that like for you? Have you ever hit plateau and what was the outcome of that? What did you do? What was the discussion with your doctor? I want to hear it all. Comment below, let me know, and I will see you all next time. Goodbye.